My name is Dr. Sam Phiri. I'm a physician and clinical epidemiologist. I'm from Malawi. I got involved actually when I graduated as a physician, and then when I started working in the medical department at Kamuzu Central Hospital. As you know, in developing countries, actually most of the diseases which we see are infectious diseases, mainly looking at malaria, tuberculosis, HIV and AIDS and others. So when in 1997, when I was working in the medical department, I saw that because of the availability of AIDS, then most of the patients were coming into the hospital. About 2 out of 3 had HIV-related conditions in the hospital. So the question which was coming up was to say, okay, how best are we going to manage these people? Now, before I continue, I have also a personal story whereby in the family, one of my cousins actually had AIDS, and he died of AIDS, and also one of my sister-in-laws actually had an issue whereby got actually HIV and also died of AIDS. So I remember that quite well because these people died because antiretroviral therapy, the life-saving antiretroviral drugs, were not available by that time. So with that, I was part of the team, co-founder of the Lighthouse Trust, which is an integrated HIV prevention, treatment, care and support program in Malawi, which is the largest actually integrated center in Malawi. This Lighthouse actually sees, for example, currently as I'm speaking, that time it was only seeing patients just to manage them on their opportunistic infections. If someone comes in with diarrhea, someone coming in with tuberculosis, just to treat them for that. But before 2000, antiretroviral drugs in Malawi were just a dream. So the issue was, let's have a way whereby patients who are coming in can be managed in a proper way at a center, providing an integrated management, looking at HIV testing and counseling, clinical care, and also community home-based care. Malawi is a small country in the southern part of Africa. It has a population of about 13 million, 13 million. And AIDS situation is that the first case actually was identified in 1985, and you're looking at 1 out of 10 people being infected with HIV. So out of the 13 million, because the prevalence of HIV in Malawi is around 12%, this is in the reproductive age group between 15 years and 49 years. And as I'm speaking, we expect the estimated 900,000 people who are living with HIV in Malawi. Now, as I mentioned earlier on, previously, if you tested for HIV and you were positive, it was like a death sentence. There was even no motivation for someone to go for HIV testing, because the question was, what next? So the Malawi program looked at it as an issue, and in 2000, the government of Malawi, using the political will, decided to do what we call the cost sharing, to introduce life-saving antiretroviral therapy, whereby Malawians were contributing about $25 per month. But this was not actually affordable for most of the Malawians, being poor people in the resource-limited country. So in 2002, with actually political commitment, it was decided to make sure that Malawi should go for an application in the round 1 of the Global Fund. So it looked at an assessment, as I mentioned already, 900,000 people living with HIV, 85,000 new infected patients per year, 85,000 deaths per year, and knowing that in Malawi, the 3 common causes of death amongst women, amongst children, are AIDS, tuberculosis, and malaria. So understanding this, when the call for Global Fund came out for proposals, Malawi actually started to say, let's actually develop a proposal. Now, there's one thing which I need to mention is the way the proposal is developed. The government commitment, and also in partnership with the UN family led by the World Health Organization and the United Nations Development Program, UNDP, and other members of the UN. Then other unilateral and multilateral development partners, the civil society, including the local and international non-government organizations, the faith-based organizations, and the community members within the country. So put up a proposal to the Global Fund to say, would like to have a program which is going to treat people for HIV. And in 2002, the proposal put in 2003, this proposal, actually the disbursement was done whereby it started to make sure that it should manage people, and 60% of the 200 million US dollars which was provided in the first round to Malawi, 60% was mainly for treatment. And out of the 60%, so 90% of that was mainly for the life-saving antiretroviral drugs. So just to mention, before the Global Fund, as I mentioned already earlier on, in 2003, using the cost-sharing antiretroviral therapy program, there were only 3,000 patients who were ever studied on antiretroviral drugs. Now, you know, out of the 900,000, we're expecting about probably 300,000 of people needing antiretroviral therapy using the assessment of the World Health Organization called the staging of stage 3 or stage 4, and also using, if CD4 count was available, of that time actually less than 200. So let's look at now during the Global Fund when it was being implemented. What has happened is that from 2003, progress, how it has happened, as you can see, from 3,000 patients on antiretroviral drugs. As of 31st March 2010, there have been 211, so over 211,000 patients alive on treatment in Malawi, in care. So these are the people who have been studied on treatment, and then they are now alive on treatment, of whom I can say that about 50% of them would have died if they were not actually put on this treatment. And as I mentioned, 60% of the 211,000 are women. And as you know, that 60% of the HIV positive are women also. And about 9% of the 211,000 are actually children, and these are under 15 years. So you can see there that the Global Fund was able to provide money to support the treatment program in Malawi, starting now having 211,000 on treatment. On top of that, as of 2009 only, 1.7 million people got tested for HIV, so they knew their HIV status, which is an entry point for HIV treatment and care, and also for prevention. So the program actually does prevention, and then it does treatment, and also I should mention about the prevention of mother-to-child transmission. So actually all pregnant women presenting to the antenatal clinic are tested for HIV using the opt-out strategy. They can decide to decline, and then those who are positive, then they are given prophylaxis. Some of them are given treatment. So as I'm speaking, the prevention component is in there. So this is actually quite important for us to know, because I wanted actually to link this up to the Millennium Development Goals. As you know that this is 2010, and this is what I call countdown to 2015 for the Millennium Development Goals. If someone, as I mentioned that in Malawi, the leading causes of death, really, we're talking about tuberculosis, AIDS, and malaria, and the Global Fund is covering for those 3 diseases. So actually over half of the deaths amongst women and pregnant women is actually due to tuberculosis and also AIDS and malaria. And actually about 18% of the deaths amongst children is actually attributed to malaria itself. So just to mention that, you look at Millennium Development Goals number 4, 5, and 6. So 4, this is reducing child mortality. So if you are doing for example, the treatment for HIV, if you are doing prevention of mother-to-child transmission, and if you are also providing treatment for TB, and in 2009, over 1 million insecticide-treated bed nets were distributed in Malawi, and most of these are also attributed to the Global Fund. So it means you are targeting the Millennium Development Goal number 4. Now you go into Millennium Development Goal number 5, which is actually improving maternal health. So if you are doing prevention of mother-to-child transmission, if you are doing actually ITNs, if you are actually doing the treatment for TB, you are actually to provide improved and quality care for the women. Now, Millennium Development Goal number 6, I don't need to mention about it because it's the main HIV and AIDS. So this is also being affected. Now, we've looked at 4, 5, and 6. Now, let's look at the Global Fund. Why, I'm sure you'll be asking, why has it been successful? One of the things which is there is that there's this partnership, the public and private partnership. So the government, the development partners, and the civil society, and the private sector in Malawi, because the Global Fund puts in what is called as the country ownership. So the country decides the national response strategy and then decides on how best they're going to deliver their program. So because of that, then you're touching on the Millennium Development Goal number 8, which is actually looking at that component. So as you can see there, I just wanted to highlight what because you are saying, okay, you are doing, Global Fund is targeting TB, HIV, and malaria. Now you see how diverse it is in terms of providing the support to most of the developing countries. Now let me finish on this looking at the one thing, which is, apart from providing treatment, most of the resource-limited countries have human resource crisis. The infrastructure is not good. So the Global Fund also has leveraged the strengthening of the health systems. So health system strengthening has been a component within the Global Fund. So although you're focusing on HIV management, malaria management, and TB management, you are able, for example, infrastructure for laboratories and support to human resource for retention, and also some of it has been to look at what the monitoring and evaluation in order to see how the programs are doing. So this is actually leveraging the health system strengthening rather than only providing the treatment.